Welcome, dear moms. The importance of folic acid for mother and baby in the first trimester. What is folic acid? Folic acid, also known as vitamin B9, plays a crucial role in the early stages of pregnancy. It is essential for the proper development of the neural tube, which later forms the baby's brain and spinal cord. The first trimester of pregnancy is a critical period for fetal development, and sufficient folic acid intake can prevent serious birth defects. In this article, we will explore the importance of folic acid for both mother and baby, its benefits, recommended intake, sources, and potential risks of deficiency. The role of folic acid in pregnancy. Folic acid is a water-soluble vitamin that helps in cell growth and DNA formation. During pregnancy, the need for folic acid increases as rapid cell division and organ development take place in the fetus. It is particularly vital during the first 12 weeks of pregnancy because this is when the neural tube closes and the foundation for the baby's central nervous system is established. Benefits of folic acid for the baby. Prevention of neural tube defects, NTDs, such as spina bifida and anencephaly, occur when the neural tube does not close properly. Folic acid significantly reduces the risk of these birth defects. Supports brain development. Adequate folic acid intake contributes to healthy brain formation and cognitive function. Reduces risk of congenital heart defects. Research suggests that folic acid may also lower the risk of certain heart defects in newborns. Prevention of cleft lip and palate. Studies indicate that sufficient folic acid consumption may help prevent facial and oral deformities in babies. Enhances proper cell growth and development. Folic acid supports normal fetal growth and prevents abnormalities in other organs. Benefits of folic acid for the mother. Prevents anemia. Folic acid helps in red blood cell production, reducing the risk of anemia during pregnancy. Reduces the risk of pregnancy complications. Adequate levels of folic acid may lower the chances of preeclampsia and premature birth. Supports maternal tissue growth. It aids in the formation of the placenta and supports the expansion of maternal tissues. Improves mood and mental health. Folic acid plays a role in neurotransmitter function, potentially reducing the risk of depression during pregnancy. Lowers the risk of miscarriage. Some studies suggest that a deficiency in folic acid may increase the risk of early pregnancy loss. Recommended folic acid intake. The recommended daily intake of folic acid varies depending on the stage of pregnancy. Before conception, 400 mcg per day, first trimester, 400 a 600 mcg per day, second and third trimesters, 600 mcg per day. Women with a history of NTDs in previous pregnancies, up to 4000 mcg per day, as advised by a healthcare provider. Natural sources of folic acid. While folic acid supplements are widely recommended, it is also beneficial to include natural sources in the diet. Foods rich in folate include leafy green vegetables, spinach, kale, broccoli, citrus fruits, oranges, lemons, grapefruits, beans and lentils, fortified cereals and bread, nuts and seeds, eggs and dairy products. Consequences of folic acid deficiency. A deficiency in folic acid during pregnancy can lead to severe complications for both mother and baby. Some of the risks include neural tube defects, NTDs. As mentioned earlier, insufficient folic acid intake increases the likelihood of birth defects such as spina bifida and anencephaly. Low birth weight. Babies born to mothers with folic acid deficiency may have a lower birth weight, which can lead to other health issues. Preterm birth. A lack of folic acid may contribute to premature labor and delivery. Maternal anemia. Folic acid deficiency can lead to megaloblastic anemia, affecting the mother's energy levels and overall health. Increased risk of preeclampsia. Some research suggests that inadequate folic acid levels may be linked to a higher risk of preeclampsia, a dangerous pregnancy condition characterized by high blood pressure. Supplementation and fortification. Many countries have implemented folic acid fortification programs to reduce the incidence of birth defects. Fortified foods, such as cereals, rice, and flour, are common sources of folic acid. However, Taking a prenatal supplement containing folic acid is the most reliable way to ensure adequate intake during pregnancy. When to start taking folic acid? It is recommended that women of childbearing age take folic acid supplements even before conception, since neural tube defects develop within the first 28 days of pregnancy. Often before a woman knows she is pregnant, starting supplementation early can significantly reduce the risk. Folic acid is an essential nutrient for both mother and baby during the first trimester of pregnancy. Its role in preventing neural tube defects, supporting fetal development, and maintaining maternal health makes it a crucial component of prenatal care. Expecting mothers should ensure they consume enough folic acid through a combination of a balanced diet and supplements to promote a healthy pregnancy and reduce the risk of complications. Consulting a healthcare provider for personalized advice on folic acid intake is always recommended to ensure optimal health for both mother and baby. Thanks. Take care.